Hello, dear colleagues. Can you hear me well? Can you please write in the comments if you can hear me and you see the picture and you can hear me clearly? Hi. Okay, thank you for your feedback. Okay, let's start our seminar. I'm very glad to greet all of you at Jalupro amino acid replacement therapy. Let me introduce myself. My name is Evgenia SHELEMBA. I'm originally from Russia. I was born in the northern part of Russia, and then I moved to Ukraine when I was 22 years old, and I graduated in Ukrainian university and got my dermatologist degree. And after I obtained my dermatologist degree, we moved to the UAE with our family. Okay, I see the sound poor quality. Please, someone else, can you type the sound? Can you hear me well? So we moved to the United Arab Emirates, and I was working as a dermatologist in a very well-established, well-known clinic, which is called Canadian Medical Center. And I was injected quite a lot of Jalupro, and I will show you later my first photos of injection, and I will show you the evolution of injection techniques, how injection techniques are changing with time, and what are now the most up-to-date injection techniques. After 5 years in UAE, we moved back to Ukraine, and now I work in a private clinic as a dermatologist, and I also work as a head of training and research department in a distributor company, and we are distributors of the greatest brands that I know, such as Jalupro, such as Restylane, Dermaceutic, Image Skincare, JBP, Lion Cursen, and Threads, needles and cannulas. So we have a lot of great, interesting products, and Jalupro is one of our top products. We are always out of stock because we with Jalupro, because Ukrainian people, doctors, they love to inject Jalupro because they really see the result. So we have developed a lot of a lot of very interesting protocols, a lot of very interesting injection techniques, and I will show you during my presentation. I will talk a little bit about theory, and then I will talk about practical tips, and then I will also show you the videos of injection techniques and of mixing products, because we can also mix Jalupro with some other products, but we will talk later about it. If you have any questions, type them please in the chat, because I will try to read it as I speak. Not to forget to mention something important. Let's greet Jalupro. Let's greet Eduardo Conti, who is the head of the professional derma company. And a few words about the company. It was started by Eduardo's father, Franco Conti, in Switzerland, and for more than 10 years it has this company has been producing the amino acid products. The main office is in Lugano, Switzerland, and Professional Derma is a registered distributor in more than 30 countries around the world, maybe even more now at the moment. And except aesthetic products, they are producing products for eye treatment, for rheumatology, and of course a lot of aesthetic dermatology products. So today we will talk about, first we will remember with you the components of the extracellular matrix and why extracellular matrix is important for our youth and beauty of our skin. Then we will talk about the reasons of extracellular matrix aging and how we can prevent them, how we can reduce the aging of the extracellular matrix. And we will talk about the algorithm of treatment of aging skin, not only from outside but also from inside. We will show you before and after results of amino acid replacement therapy, studies of Jalupro, and we will show you the new protocols of Jalupro 5.5 and the Alutoxin. It is Jalupro mixed with neurotoxin such as Botox or Dysport. Okay, so the seminar will take about 1.5 hours, maybe 2 hours, so get ready, but we are recording this seminar as well, so you will be able to watch it later. And I will be looking forward for your questions. If you don't have sound, check your computer, because my microphone is on. Maybe you need to check your computer, or if something goes slow or you can see the picture well, try to reload your Wi-Fi roamer. Hi, it's very nice to see people from so many countries. Even though we cannot travel too much right now, we still can communicate and talk with each other and share experience. Right now I am in Kiev in Ukraine. We have a lot of snow, more snow than we had in last like 30 years. It's a very, very long and cold winter this time. We know that aging of organism is to a high degree aging of the extracellular matrix, because in many tissues, the most part of the tissue is composed from the extracellular matrix. It is a complex three-dimensional network of macromolecules that provides spatial information and architectural scaffold for cells. There have been studies which prove, and they show us, that the interaction of cells with the extracellular matrix affects their phenotype. For example, in one of the studies, when the aged cells were put in the young extracellular matrix, their morphology has changed, their proliferative potential has restored, they have become more receptive to growth factors, the levels of intracellular oxygen have increased, the length of telomeres even increased. And on the opposite, when the old cells were placed in the young extracellular matrix, they got aged faster and their phenotype has changed in a worse way. Why does it happen that extracellular matrix affects our cells so much? Extracellular matrix actually induces some signals that regulate the behavior of cells. They regulate differentiation, adhesion, migration, nutrition, tissue regeneration and remodeling, the development of the new vessels, and the formation of the intracellular contacts. And because of the extracellular matrix, tissues keep their normal architecture. And when something changes, for example, when extracellular matrix gets harsh, it becomes a fibrotic disorder. Or on the opposite, when it becomes loose, it is the degenerative disorder. So what are the components of the extracellular matrix? It consists of several proteins. For example, first of all, the different types of collagens. The collagen proteins, they provide the tensile strength and the resistance to deformation. Then there are non-collagenous proteins, such as elastin, fibronectin, and laminin. These proteins, they tolerate the mechanical insults to the tissues, and they provide the extensibility and reversive recoil of the tissue. The next component are mucopolysaccharides, and the most abundant of the mucopolysaccharides is hyaluronic acid. It helps to dampen the mechanical forces, and it gives like a cushioning of tissue under compression. Also, there are growth factors and cytokines, the molecules by which cells interact with each other and send signals to each other. And there are metalloproteinases. These are like ferments that help to degrade the extracellular matrix, such as collagen, such as elastin, and such as hyaluronic acid. And also one of the important parts of the extracellular matrix are integrins. Look at the photo and see those yellowish green ovals in the membrane of the cell. These are the transmembrane proteins by which the collagen bundles attach to the cell. It is very important, and we will remember about this fact later. So please take note of integrins. So collagens are a family of distinct extracellular matrix proteins, and they compose about 30% of proteins of our body and 90% of dry skin mass. Mostly these will be first and third collagen. Collagen molecule, it has a very difficult and very very difficult structure, because it consists of 3 polypeptide alpha chains, and each alpha chain has more than 1,000 amino acids. So when scientists have checked which amino acid composes collagen, they have determined that about 33.7% of amino acid is glycine, about 13.3% is proline, 9.7% is hydroxyproline, and 11.6% is alanine. And because of this like intricate 3-dimensional structure, the collagen molecule, it is very, very firm. It helps to make tissue strong. It helps to give it the resistance to deformation. But at the same time, because of this difficult and composed structure, the collagen molecule needs the specific ingredients to be built in a proper way, to be strong and not loose. So it was determined that collagen polypeptide chain consists of triplets, and these triplets of amino acids is called the collagen melody, or the C-peptide. The C-peptide is the chain of amino acids, and they always repeat. For example, glycine, X, and Y. And always in the first place there is glycine, and on the second and the third place there can be different amino acids, but mostly they are proline or hydroxyproline or hydroxylysine. Glycine is one of the simplest amino acids in nature, and it is called so because it is a little bit sweet when you taste it. That's why the Greek word glucose means sweet. That's why the glycine has its name. Also, we have elastin fibers in the extracellular matrix. They have a simpler structure than collagen chains, and they have only 4 polypeptide chains, but they usually do not make any difficult three-dimensional structure. And elastin also contains from amino acids, most abundant of which is glycine, proline, valine, and alanine. Glycosaminoglycans. You know hyaluronic acid very well, so they are large negatively charged molecules. They attract a lot of water molecules, which leads to a formation of hydrated gel. So glycosaminoglycans, they build the extracellular matrix, and they give the hydration of the tissue, so that the cells of the tissue will send messages to each other, as we said before. But we know that with time, the collagen structure of dermis starts to change. After 80 years of age, the speed of the collagen formation decreases, and the activity of collagenolosis, it means the degradation of collagen, it increases by 75%. So usually in the young skin, the collagen fibers, they are thick, they are packed tightly. In the older dermis, the collagen fibers are thinned, they are fragmented, they have spaces between them. In elastin net, the same. The elastin fibers, they get fragmented, they get beaded, and they lack the terminal fibers that extend into the epidermis. This is a very interesting photo, and it brings us back to the integrins. I told you they are transmembrane proteins that help to which the collagen bundles attach, and the collagen bundles in the young skin, when they are strong, they kind of spread the fibroblast, and in this way the fibroblast can produce the extracellular matrix components. It works properly, it produces collagen, elastin, and hyaluronic acid. But in the aged skin, when the collagen is degraded, the fibroblast collapses, and it becomes a fibrocyte. It looks like this collapsed balloon, I would say, on the second photo, and therefore it can it cannot develop the extracellular matrix components properly. Therefore, it is very important to understand the reasons of degradation of the extracellular matrix, help to prevent the degradation of collagen, and also to help to our body to build the new, very strong collagen. Here is also like a three-dimensional picture of the like a scheme, which helps us to see the fibroblast stretched by collagen and elastin fibers. And when it is stretched, it works well. It means that our skin is young. And there are a lot of factors that lead to aging of our extracellular matrix. And one of the first and most important factors is UV radiation. We all know this picture from New England Journal of Medicine, which shows that a 69-year-old male who was working as a van driver for 28 years. And we can see the side of his face, which was under the sunlight. It has aged much more than the other side of the face, which was less affected by the UV rays. Even single sun exposure to UV ray emission reduces collagen production by 80%. And also the chronic UV exposure, it increases the expression of matrix metalloproteinases, and which is followed by collagen degradation. Therefore, we need to explain our patients about the importance of UV protection, and also we need to understand that exposure to solar UV radiation, it initiates the synthesis of metalloproteinases without subsequent upregulation of new collagen production. Therefore, it's one of the most important factors that leads to collagen loss and extracellular matrix fragmentation. The next reason is the chronic inflammation in our body, or inflammaging. Therefore, I always tell my patients to try to keep the anti-inflammatory diet to decrease the inflammation, the chronic inflammation in the body. Next is the advanced glycation end products, or AGE. They are formed as a chemical reaction between amino acids and reducing sugars, which come to our body with the food. Therefore, these advanced glycation end products, they make our tissue less strong, they make our collagen degrade, and therefore we age much faster because of the glycation end products. Glycation of extracellular proteins, it induces a cross-linking of collagen and elastic fibers. The elasticity of extracellular matrix is altered, and it affects the vascular functions, and it alters the balance between the synthesis and degradation of extracellular matrix, which leads to the increase of the stiffness and the decrease of elasticity of our tissues. Next is the impairment of blood circulation, because we know that our extracellular matrix needs the capillary support to bring the nutrition and oxygen to the tissue. One of the other reasons is smoking. Hormonal factor, of course, because we know, for example, that estrogen stimulates synthesis of components of dermal matrix, and also stress. And I like to show this photo of American presidents who have, and we can see how much they have aged during the years of their presidency, which of course shows us that stress and the impairment of humoral regulation is an important factor of extracellular matrix aging. Here we can see the histology of the young skin and of the aged skin, and the schematic representation of it. And we can see that with intrinsic aging, we have the decrease of collagen bond density in our skin, but when intrinsic aging goes together with photoaging, it means that the collagen density is very low. And here on this slide, we can see the histological sections which show the collagen disorganization, and the red color is type 1 collagen, and the green color is type 3 collagen. And we can see that with the age, we have less amount of first type collagen, the amount of the green or type 3 collagen increases, and we can see the fragmentation of collagen bundles. We can see that they are not intact anymore. Apart from these factors, the epigenetic factors that we have already discussed, we have also the genetic factors that affect our aging, because 85% of people have connective tissue disorders, and we can check it in the laboratory if we have this disorder or not. But we know that the clinical result it is affected by 40% with genetics and by 60% with our lifestyle. And if we look at these ladies, can you please write in the comments how old do you think they are? Like how old is the first lady, the second one, and the third one? What is the age of the ladies on this photo? Approximately, like what do you think? 40, 50, and 60. Okay. All 36. 35. Okay. 40, 50, and 60. 35, 40, 45. Okay, thank you for your guesses. Good tries. So I will tell you the right answer. First one is 47. Second lady is 47. And the third one is 43. So A and B is 47. And the last one is 43 years old. I think they are all about the same, but have aged differently. Yes, it's true. Because their aging was affected by their genetic and epigenetic factors. I will write in the comments once again, 47, 47, and 43. Because most probably the last patient, she has a minor connective tissue disorder, which is also affected by the environment, which is affected by the sun exposure, by smoking, by the improper diet. Maybe she doesn't have protein in her diet. And usually when we have such patient coming into our clinic, she would be the most difficult patient to change, the third one. Because usually when we start working with such patients, it's very hard to do something that will bring them the result, that will give the good result. Even the plastic surgery wouldn't be the best option, because after several months she will come back and her tissues will be loose again. Therefore, it is very important to try to find out whether our patient has a minor connective tissue disorder, and also try to affect her lifestyle. Try to explain her about the importance of sun protection, about the importance of the healthy diet. These can seem like a small things, but they help us to make a big difference when we get to the result. And I'm talking about it because when I usually such patients, they also have the psychological problems. Like they come to you and they are always unhappy with whatever you do for them. They say, like, I don't see the result from anything. I always have bruises. I recover. It takes me so much time to recover from all of your procedures, from all of your injections, and still I don't have the proper result, the result that I was hoping for. So even if I will do the machines, if I will do RF microneedling for this patient, if I will do the like SMAS lifting, like Altera, or some or CO2 resurfacing, I will in 100% of cases of such patients, I will prescribe for her the oral supplementation with amino acids, and I will also recommend her to do the course of amino acid replacement therapy to support her extracellular matrix, to help her tissues to build the new collagen and the elastin. And we will discuss with you this algorithm in details in just a minute, but first I will show you the next slide, which shows the factors, the most studied factors that enhance the production of the extracellular matrix. One of them, what supplements do you recommend? Talk about the supplements, it's a very good question, and thank you, Claire, for this question. We will discuss the supplementation. Wound response, it is the one of the factors that have we have been using for many years in aesthetic medicine. It's like all of our injection mesotherapy, microneedling, dermaroller. It helps to get the wound response, which triggers rapid collagen degradation by matrix metalloproteases, which is followed by induction of the new collagen synthesis. Remember, when we were speaking about UV exposure, we said that it triggers the collagen degradation by matrix metalloproteinases, and it is not followed by induction of new collagen synthesis. But wound response, it is followed by induction of new collagen synthesis by fibroblasts. So it helps to restore the lost collagen in the dermal extracellular matrix. Next one is injection of the space-filling hyaluronic acid, and also the high molecular weight hyaluronic acid. There are also studies which prove that high molecular weight hyaluronic acid helps to build the to affect the fibroblast and to make it build the new collagen in the skin. And also one of the most studied treatments is the topical treatment with retinol, which helps to increase the collagen production and decrease the metalloproteinase expression in the human age skin. I think that most of the studies are about the topical treatment with retinol, because it has been studied for more than 20, even 30 years. Also, one of Jalupro speakers and the person who did studies, and we will talk about them later, studies of Jalupro, Dr. Elena Rumyantseva, she likes to show this example. And she shows that the queen bee and the worker bee, they come from the same genetic material. And it depends how we feed. How we feed it. If it eats the royal jelly, it becomes the queen bee. And if it eats the worker jelly, it becomes the worker bee. And it is amazing and fascinating that the same genetic material affected differently by the diet can become a queen bee or a worker bee. And not only it looks different, it also has the same, it has the different lifespan, because the queen bee, it lives more than 2 years, and the worker bee, it lives around from 3 to 6 weeks. That's why it is extremely important to explain our patient about the importance of the supplementation, about the importance of the healthy eating, and the importance of the supplementation of the extracellular matrix with amino acids, because as we can see at the scheme of the collagenesis, that collagen forms from amino acids. It needs only glycine, proline, and some other amino acids. And inside the fibroblasts, in the ribosomes of the fibroblast, it goes through the chain of the reaction, and when it goes to the extracellular space, it is affected by vitamin C. It is oxidized and becomes a mature collagen. It leads to the synthesis of the mature collagen. But when we have the deficiency of vitamin C and of the three other factors that play a role in the collagen synthesis, such as copper, vitamin B6, and vitamin B13, we have the abnormal and loose collagen, because we have spoken with you in the beginning that the collagen molecule, it is a three-dimensional spiral, and it has a very complex structure, and you need the specific building blocks to build a good collagen. I can see your questions. We will talk about microneedling with Jalupro. We will talk about the injectors when we will discuss the practical part. So I will answer your question in just a few minutes. And when we have the deficiency of these components, the collagen is loose in the tissues, and it is not built properly. But on the opposite side, when I see the products for biorevitalization that have like 50-60 components in them, it makes me very surprised. Why would you put so many components in your biorevitalizant if you don't need so much? If you need, what you need is amino acids, vitamin C, which you already have in your body, copper, which you also have, but you can also take a copper supplement, B6, B13. I think that products, in my personal opinion, the products that have too many components in them, they make us prone to the allergic reaction, and we have a higher chance of our patient developing an allergic reaction if we put so much stuff in the extracellular matrix, unnecessary stuff. For me, it looks like a crowded room which already has a lot of stuff inside, and you want to improve it somehow, and you just bring some extra stuff. It just makes the extracellular matrix even more dense. The interaction between cells, it decreases, and it is more difficult for cells to send signals to each other through the extracellular matrix, which already has the degraded collagen. And we put a lot of extra unnecessary stuff, which will not be used in the process of synthesis of mature collagen. Okay. Therefore, the point is not to put the extra stuff in the extracellular matrix and to choose the product for the biorevitalization. And there is a algorithm of anti-aging procedures which was developed, and many PhD theses. I've read a lot of articles on it. So it has three stages. At first stage, when we see the patient, we can start with some chemical peeling. We can start working on the epidermis, and at the first visit of the patient, I always administer the amino acid complex orally, because all of us have the amino acid deficiency. It is proven by studies. I have read a study which tells us that we have about 8 grams per day deficiency of glycine, and even though we explain our patients about the healthy lifestyle, they still don't eat enough proteins. They don't, and even if they eat it, a lot of people, they have the problems with ferments, so they cannot digest the protein that they eat, and they cannot break it into amino acids. That's why before I start doing any procedures with my patients, I prescribe amino acid complex. At the second stage, we break the pathological which amino acid complex. We will come to this part. Thank you for your question. On the second stage, we break the pathological collagen. We can do it with ferments. Some doctors, they inject collagenase. Some do fractional photothermolysis, and other procedures, they help to which activate the metalloproteinases, as we spoke in the beginning, and which help to break the pathological collagen, which is degraded and which is broken, which is the one that is stiff. And starting from the 5th day after the procedure, we can start doing the amino acid replacement therapy. We do the intradermal injections of amino acids, and we create the perfect environment for fibroblasts to produce the new collagen. And also you can prescribe the medicine that improves microcirculation. And then I use the Aqua Gold Fine Touch in the cocktail. This be the same with Jalupro. We will talk about the ways to combine Jalupro with other products, and I will answer your question. And when we build the new collagen, when we build the new collagen in the skin, we can constrict these new collagen fibers with our machines, such as laser, such as HIFU, the machines which help to constrict the new collagen fibers. How this it also helps me, this algorithm, it helps me because amino acids and the collagen is also the part of our blood vessels. So this amino acid complex, it helps to strengthen our blood vessels. That's why our patients will have less bruises, and they will have the faster rehabilitation, and they will have better recovery after procedures. Have you had any side effects with Jalupro? No, I didn't have any side effects with Jalupro, except the effects of injection, for example, such as bruising, but not from the product. Why I didn't have any side effects from the product itself? Because it is a very high quality product. As you know, it is made by the Professional Derma company, which is registered in Lugano, Switzerland. And Jalupro is based on the unique formula of amino acids. Amino acids such as glycine, proline, lysine, and leucine. These amino acids, you can see in the percentage that they are in strictly balanced proportions. So the percent of amino acids is strictly measured. It is not more, not less. And it is very important because we don't want to put some extra things in our extracellular matrix. We don't want to make this crowded room even more crowded, and we don't want to bring any garbage in this room. Also, it is important that the amino acids are in the L form. What does it mean, the L form? You know that we have the isomers, the R1 and the L1, the right and the left. So the ones that will be included in this spiral, in this collagen spiral, is L. there are ones they will not be used. They cannot be built in this three-dimensional collagen bundle. That's why they will also make our extracellular matrix more crowded, and they will lead to bruising and to the extra swelling, because we don't have, because these amino acids, they are produced in the laboratory, and it is very important, because we know that we also can get the amino acids from beef, for example, beef tendons, or from the shark, from the skin of different fish. But it is very hard to get the good quality, because very often with the beef collagen we get a lot of toxins with which this beef is fed, and usually such collagen, it is very expensive, the good quality one, because Jalupro is synthesized in the laboratory. It has the perfect quality, and it is perfectly clean from any other stuff, such as toxins, and such as the isomers that cannot be built inside the three dimensional chain. Okay, so because we have all of these necessary amino acids in the strictly balanced proportions, when we inject this amino acid cluster in the extracellular matrix, we get the chain of the reactions. We have the chemotaxis of fibroblasts, because amino acids, as I tell to my patients, amino acids is like food for your fibroblasts. It is like building blocks from which fibroblasts will build collagen. So the speed of the collagen degradation decreases, and fibroblasts become to divide and to multiply, because they have the abundance of amino acids around them. And we get the stimulation of collagen synthesis, and we get the production of growth factors. So which supplement do I recommend to my patient? I recommend them to take Jalupro oral supplement, which has the amino acid functional cluster, which has glycine 2 grams per dose, which has proline, which has lysine, and which has vitamin C. So I recommend my patients to take 4 tablets of Jalupro oral supplement per day, but I also tell them that it is not actually a tablet, it is a pressed powder of amino acids, and it is very important, because you don't have any extra components in it. It is just the amino acid powder, which is firmly pressed and which you need to chew. And for patients who cannot chew, we have the Jalupro in the sticks. It goes in the liquid form, and it doesn't have vitamin C, but it has all of the amino acids, and you just put this liquid Jalupro from the sachet in the glass of water, and you drink this glass of water in the morning. I tell my patients that you need to take this supplement for 3 months, because the amino acids will go to our tendons, they will go to our blood vessels. Yes, there are some actually, right, Eduardo, one of our patients, she disperses the tablets in water. She likes to, they are water soluble, right? Why is Jalupro supplement better than other supplements that contain collagen? Joanna, okay, I will answer this question now. So we have different types of collagen. We have gelatin. It is like the beef tendons which were heated, so it has a very rough structure, and it cannot be digested properly in our intestines usually, so it doesn't help to improve our extracellular matrix. Next is the hydrolyzed collagen. It is like a collagen molecule which is cut into pieces, which is cut into the long sequences by the fermentation process, like hydrolyzed collagen. So it has a longer chains of amino acids. It is also hard to digest because we still need ferments which help to break this chain into the shorter amino acid sequences. When this collagen is hydrolyzed for a longer time, or is hydrolyzed more, we get the B and tripeptides. It means that we have a small short chains of 2 amino acids or 3 amino acids. So they are more easily digested and absorbed in our gut, and they are built in the extracellular matrix. And the last one is amino acid. Amino acid, like Jalupro oral supplement. It is just separate amino acids which are fully absorbed in our intestines. We don't need any ferment to break them into smaller pieces. So first advantage of Jalupro supplement is it can be absorbed in our gut completely, and it is very easy to build in the collagen molecule. There have been made like about 8 randomized placebo-controlled studies in the world concerning collagen and its role in the skin, in the improvement of skin. And it has been proven that B and 3 peptides of collagen, so these short sequences of amino acids, like 2 and 3 amino acids in a chain, they really play the role in the improvement of the extracellular matrix. But the hydrolyzed collagen or gelatin, it's not proven that it improves our extracellular matrix. And the same with the amino acids. They have the highest bioavailability, so they can really improve our collagen. So I hope, Ioana, that I have answered your question. I will check the other questions because now I can see like a lot of good questions coming. If a patient is under therapy with biological agent, can they take the Jalupro supplement? Yes, you can take the Jalupro supplement. It can be combined with any other supplements. It can be with any other supplements or any other medication, because it is like amino acids, the same amino acids that we would eat with a steak, for example. Also, children can take Jalupro supplement. Pregnant women can take Jalupro supplement. Okay, I will check. Dimitra, I hope I have answered. The 4 tablets per day can be taken at the same time, or do they have to be taken with a time difference? I'm afraid I will not read your name correctly, Jose, or I'm sorry if I don't pronounce your name properly. Thank you for the good question. Yes, the 4 tablets can be taken at the same time, or you can take 2 tablets in the morning and 2 tablets in the evening. The thing is to try to take them separately from food to improve the absorption. For example, you can take them 4 minutes before, like 30 minutes before food, or about 1 hour after food. This way you will increase the bioavailability of the tablets. The course is prescribed for 2 to 3 months. I recommend on around 3 months, and the package contains 120 tablets because you take 4 tablets per day. The can is enough for 30 days, like for 1 month. So for a course, our patients needs to buy 3 packages of Jalupro, and the same with the sticks. Okay. Jalupro have oral supplement preparation, or there is injection preparation too, Dr. Ingrid. Yes, there is supplement preparation and injection preparation, and we will talk about it in a moment. We will move to the injection preparation. Christy, is marine collagen oral drink supplement as good as Jalupro amino acid tables, or are both needed? Great question. So marine collagen, it contains the most probably the hydrolyzed collagen, which is not proven to affect our skin and our collagen. If it contains the bi and tripeptides, it is better. But it is very hard to check the quality of the collagen which goes in these cans. Like only 2 or 3 brands that I know, they have the really the no toxins. They have been checked, and it has been proven that there are no toxins, no harmful substances that go with them. Usually, such oral supplementation, such marine collagen supplement, it is usually when it is high quality one, it is usually very expensive. Otherwise, it is made from the fish which is grown in the tank and which is fed by the not very good like products. Because Jalupro oral supplement is developed in the laboratory, so amino acids are made in the laboratory, they are completely clean. They are measured by the amount and even by the isomer, the right or the left one, and also they are affordable. So they have a good price which we and our patients can afford. That's why for me it's a perfect choice. There is an injection. Yes, we will talk about the injection Jalupro. Yes. I just like to talk about, I'm glad that I have answered your questions. No, it doesn't. I don't mean that tablets are better than liquid. I mean that they are pretty much the same. How I usually do, I prescribe for the younger patients who can chew well. I prescribe Jalupro tablets, and for the older ones, if they have any teeth problems, I prescribe the liquid one. But it depends. Some people like the liquid one more than the chewing one. If a client takes the oral supplement, do they benefit from the injectable method in addition? The oral if the patient takes the oral supplement, they still benefit from injectable method, of course, because in the injectable Jalupro we also have the hyaluronic acid, and also we bring it directly to the place where it will be needed, to the skin of our face, of our neck, décolletage area, and hands or stretch marks. When we take oral supplement, a lot of these amino acids, they go to build the extracellular matrix of our bones, of our cartilage, of our blood vessels. So when we bring them directly to the skin, we see the benefit faster. Also, when I can a person take supplement with history of chronic urticaria? Yes, they can take supplement. Should the course be repeated? Also very good question. And the answer is yes, it can be repeated. And because the amino acids, they don't have the cumulative effect in our body. So we can even take the supplement without any stop, because it is like the normal food. But usually I recommend my patients to take 2 courses per year. If the patient is like our third patient on the picture, if I can see that she has the disorder of collagen, right? Connective tissue disorder, then I will recommend her to repeat this course more often. For example, she takes this supplement for 3 months, then she makes a stop for 1 or 2 months, and then she starts taking this supplement again. In the clinic where I work, we have very expensive machines. We have CO2 fractional candela, we have the Morpheus microneedling, RF microneedling. And if my patients will not see the result from the procedure, it will be a big deal, you know. They will complain everywhere because they have paid so much money and they expect to see good result. But sometimes I understand that they will not see the result because they have the collagen tissue disorder. Their skin is starving. How it will build the new collagen if it doesn't have the building blocks? That's why even for my own I recommend them to, I prescribe them to take this supplement, even for them to just to have the better result, you know, and then everyone will be happy in the end. It is not a prescription medication. It doesn't require the prescription. Jalupro supplement is better than Reverse Life 10,000 milligrams collagen. I need to check this collagen because I haven't heard about it. But it is not in the list of the checked ones that I know, like the ones that have been checked for the toxins. So I need to check. What about injection? We will talk about the injection. They can be a standalone. The supplements can be a standalone treatment before the machines, before the plastic surgery, or they can be the preparation for injections as well, or you can do it at the same time. Eduardo, when you say the food supplements, so you mean the oral tablets? Yes, tablets and the Jalupro drink, the one that goes in the sachet, is the preparation. How soon after taking the tablets the skin would look better? I noticed that after 1 month approximately, it depends on the degree of the aging of the patient, but usually they start seeing the result after 1 month, and I usually tell them and explain them that you need to take it for 3 months and that you will start seeing the result on your skin, hair, and nails after 1 month, like in this study, which was done by the company, and that shows that the trial has been done and the hair density has been checked, and it was proven that after 3 months the hair density have improved. Here we can see that after 90 days of Jalupro oral supplement, the hair density has become much better. So usually you can buy the supplements from professional derma company. It is very good. It is recommended for vegans, of course. Tablets and sachets are pretty much the same. Yes, only tablets have vitamin C as well. Yes, have improved hair condition. So we see the result on our hair, nails, and skin. Does Jalupro have component analysis that it is pure amino acid? Yes, because it is the amino acids are done in the laboratory and they are placed in this tablet very strictly. Can this be taken if trying to conceive? Yes, it can be taken, and it even recommended to be taken. Contraindications, actually, there are no contraindications for this medication. Differences for any ages, usually for the younger kids, like for 10 or 12-year ones, I will just decrease the dose. I will recommend them to take not 4 tablets per day, but just 2. If hydrolyzed collagen not proven due to the lack of studies available about the findings, or has it been found that it is? Yes, it is the lack of study, because by the placebo-controlled randomized studies, it was proven that B and 3 peptides they work. For the hydrolyzed collagen, there is a lack of studies. There is a lack of studies for in general, even like not so many studies have been done, the real good ones. Would it best for the patients to take 3 months of tablets and then have injections, or would it also work well if the patient has injection? It is very good to combine, to start taking the tablets and start doing the injections. There is no need to wait for 3 months. So I see that more questions are coming, and I will move on in my presentation a little bit, if you don't mind, and then I will try to continue answering the questions. So usually when I talk about, we will move to the injection in like a couple of minutes, and I will finish about the supplement because it has some other actions on our body, and I like to talk about them because I like to check the pharmacological action of each component. So the glycine, the amino acid, which is in the Jalupro supplement, I know it from my childhood because my father, he's a neurologist, and he has been prescribing glycine for almost all of his patients. He's a child pediatric neurologist. And in our countries, like in Russia, in Ukraine, neurologists really like to prescribe glycine for kids with anxiety disorders and for kids who don't study well at school, who have a bad memory, who are anxious, because we know that glycine is a very good nootropic medicine. It has neuroprotective, nootropic, anxiolytic, antipsychotic effect. So in our countries, doctors prescribe it for even patients under a stroke. But in the tablets that my father was prescribing, there is 100 milligrams of glycine per tablet. And in Jalupro supplement, we have 2 grams in 4 tablets, so 500 milligrams per tablet, or per tablet, yes. So you can see that how strong the action for nootropic action on our nervous system will be from Jalupro. And also our patients notice it. They start to sleep better. They become less nervous, less anxious. And as I told you, this last patient is usually always unhappy with something. So it helps also to improve her mental state. The pharmacological action of glycine is that it stimulates collagen and elastin production, it decreases stress, improves mood, normalizes sleep, and increases cognitive function. And you can try Jalupro supplement and you will notice all of these effects because of the glycine. And the taste of the supplement is a little bit sweet, and because it comes from the Greek word which means sweet. The taste of the Jalupro tablet is a little bit like with orange because of vitamin C, and the taste of the liquid one in the sachet is a little bit sweet, and it is a taste of glycine. Lysine, it is also an essential amino acid. It is necessary for the production of all proteins. It is a precursor of L-carnitine, which is necessary for lipid metabolism and energy production. And it improves the metabolism of calcium, improves immune support, and even depresses the herpes virus. Proline, it also has a large list of functions and of actions, and we also need to take it. So here we can see the Jalupro that comes in the sachet, the liquid one, and to finalize, I will repeat that Jalupro oral supplement, it has a high degree of amino acid absorption. It can be combined with other supplements, as you asked. The course is 2 to 3 months, and the course can be repeated 2 or 3 times per year, depending on the degree of the collagen tissue disorder, or depending on the lifestyle of the patient. For example, vegetarians can take it non-stop. Before the plastic surgery or any invasive procedure, you can increase the dose and take 2 sachets per day, 1 in the morning and 1 in the evening. I think I have answered most of the questions already. I will scroll down to the, and also Eduardo has been answering. I will scroll down to the end of the chat, because I'm feeling that I'm a little bit like behind you, behind all of you. And we will move to the injectable Jalupro, and we will start with studies. So the studies have been made by Dr. Elena Rumyantseva and her colleagues in Moscow, and there have been 58 women, which were divided into 2 groups. One group was women from 35 to 45 years old, and the second one was the older group of women, 45 to 65 years of age. The course was 4 procedures, 1 procedure per week. And the methods which, like first of all, the Jalupro was injected with micropapillar technique, 1.5 ml per site, with a distance of 1 to 1.5 centimeters, and the special attention was devoted to the periorbital area and the lower third, 0.6 for the periorbital area or the mid third, and the lower third and periauricular area 0.9 milliliters. So the methods that have been used, the confocal laser scanning microscopy, which helped to visualize the collagen and elastin fibers. Visual monitoring method, which helped to see the relief of the skin. The 2D ultrasound scanning, the cutometry, which helped to check the biomechanical properties of the skin. And the confocal laser scanning microscopy showed us that before amino acid replacement therapy, the protein, there was protein fibers reduction, there was fibers disorganization, their chaotic location. And we can see the fragments with high laser reflection, the bright ones, and the areas with low refraction, the darker ones. After 1 month, after amino acid replacement therapy with injections, we can see the thin fibers with even distribution, which form a reticular structure. It means that the collagen has been formed. And after this collagen is formed, we can work with our machines to constrict it if we need it. We can see the improvement of the quantity of fibers, and we can see the improvement of the epidermis and dermis thickening. We can see the density of the skin, which has increased. This is the skin surface. We can see that the skin surface has become more, it has improved. It has become less rough. And when we see by the age group, we can see that in both group there has been the significant improvement, but in the group of older patients, the improvement has been even greater. So the most evident changes were achieved in the patients in older age group, which is explainable because usually it is easier to see the result in the patient with more problems, right? So Jalupro can be recommended for skin involutional changes prevention and treatment, especially in the elderly patients. And the younger patients are recommended to undergo this therapy to prevent the skin premature aging after photo damage. And it is great that Jalupro works with such patients, with the older ones, because it's usually, as I told in the beginning, it's hard to achieve a good result. So when we look at Jalupro injectable, we have 2 types of Jalupro for the injections. First one is the Jalupro, the normal Jalupro, which goes in such a package with the blue label. We can call it like blue Jalupro. So here we can see that this Jalupro, it contains 2 ampoules and 2 vials. The ampoule contains 1% of the solution of hyaluronic acid, low molecular weight. Total amount is 3 ml. And in the vial, we can see the lyophilized amino acids, 100 milligrams. So we will use 3 ml for one procedure, for one phase, for example, we can use the full box. It will be 6 ml for a patient if we inject face, neck, and décolletage, or we can use one box for 2 patients for one phase and for another phase. The protocol is 1 session every 1 to 2 weeks. Total amount of sessions is 4 to 6 sessions. Let's look at this Jalupro. It can, as I told you, the ampule has hyaluronic acid, the vial has hyaluronic acid, and the ampule has the freeze-dried amino acids. And I told you about them already in detail. And then the second Jalupro, the high molecular weight Jalupro. High molecular weight Jalupro, it has one syringe. It has the high molecular weight hyaluronic acid, 1.5 milliliters. And the ampule has water solution of amino acids, 1 milliliter. So total, you will receive 2.5 milliliters per box of pink Jalupro. They can be both, it can be injected with microdermal papules or dermal papules with a small G needle, like 30, 32, 34, and you do one procedure once per week, total 4 to 6 procedures. And in the study that I showed you, remember the ladies had 4 procedures, and the result has I will open, and the result has persisted 4 months after therapy. So the result did not change 4 months after therapy. So you assume the maximum result after 21 days after the injection, because it is the amount of time which we need, which collagen needs to be built, right? And then you so you see the result after 21 days approximately, and it stays without changing for 4 months. So you can, all patients ask for how long I will see the result, how many sessions I need. So you explain them that based on the studies, the result stays with you for 4 months, and what happens later depends on your lifestyle. If you are going under the sun without the protection, if you smoke, if you don't eat protein, if you don't take Jalupro oral supplement, you will need to repeat the course faster than those who work also on their epigenetics. Okay, I answered how long the benefit will last. Which Jalupro is good for the scar of acne? Both of them are good, but the Jalupro high molecular weight, it will have more action on the fibroblast, because the high molecular weight hyaluronic acid also has a stimulating action on the fibroblast, as we discussed in the beginning. So I will show you my before and after case with the pink Jalupro for acne scars. Is in high performance athlete, can we use more than 6 sessions? You can use more than 6 sessions without any problem, because it doesn't have any cumulative effect. Okay, so I hope it is clear and that I have answered your questions. And now let us discuss the difference, which is very important. When you choose the blue Jalupro, the low molecular weight Jalupro, and when you choose the high molecular weight Jalupro. High molecular weight hyaluronic acid, it has the longer lasting hydration. So it stays in the tissues for a longer time. So it stimulates the fibroblast activity. And that's why when I want to do the separate procedure, for example, when I know that I don't have, for example, the machines, right? And I know that I want to do the biorevitalization. I want to do the separate injection for the patient. I will choose Jalupro high molecular weight, because the hyaluronic acid, the high molecular weight hyaluronic acid, it will have the better stimulation of fibroblast activity. Also, it has higher viscosity, so it gives a little bit longer lasting result. That's why we inject it every 2 weeks, unlike Jalupro blue one, which we inject every week. And it is recommended for aged skin, the pink one, the one where all metabolic processes are less active. That's why in the older patient, in the patient who cannot come every week, for the patient who can come only once every 2 weeks, and for the patient as a separate procedure, if I'm not preparing my patient for the course, I'm doing Jalupro high molecular weight. If I want to prepare my patient for the course of machines, if my patient is prone to swelling, like in our countries, we have a lot of patients with the deformational type of aging, where they have their face swells from from hyaluronic acid. I will take the low molecular weight hyaluronic acid, or even I can dilute amino acids with normal saline instead of hyaluronic acid, if the patient is prone to swelling. In such case, I will take the normal Jalupro, the blue one, and also the regular one, the low molecular weight Jalupro. Excuse me. And also when I work with the body, when I work with the stretch marks, I also take the regular Jalupro. How superficial should injections be? The injections can be the microdermal papules, so they can be more superficial or less superficial depending on the technique which you use. I will show you different techniques. Is it possible to use with injector? How millimeters deep? I would go like 4 millimeters, even 3. How must be the interval of injection for acne scars? 2 weeks, one procedure every 2 weeks. Is it safe to inject in patients with active rheumatoid arthritis who are on methotrexate medication? It is generally it is safe, but no studies have been done on such patients. That's why I recommend you to wait till your patient goes off the acute stage. When the patient comes in the chronic stage, then I will do the injection, but not in the acute stage, because they can have they are prone to swelling, to bruising, and you can have some side effects from anything that you do, from any procedure that you do. If you can use with microneedling, it will be the same, but when you do microneedling, you just make the channels in the skin with the needles, and then the medication goes in. It is the injection helps to bring all of the medication right in the place where you need it. So the injection is more beneficial to bring the medication in the extracellular matrix, but the microneedling, it helps to work with the surface of the skin very well. It helps to improve the the surface of the skin. Jalupro application frequency. The blue one procedure every 1 week, total 4 to 6 sessions. The pink one procedure every 2 weeks. Which is best for under eye bags? The blue one, but what the bags, like I don't like the word bags. It means that probably the patient has swelling in the periorbital area. So you don't want to put the hyaluronic acid you don't want to increase the swelling. So maybe you can take the amino acids and dilute them with the normal saline, or you can dilute them with the plasma, patient's plasma. Vital injector, I think it is like a gun, as I assume that it is a gun, mesogun. In high performance, I think I already answered this question. In high performance athlete, you can do more than 6 sessions. Which is more effective for microneedling, the blue or the pink? If you do only microneedling, then take the blue one, the low molecular weight one. Is it painful? The blue one, it is a little bit stinging when you inject it. That's why when I inject it in a micropapular technique, I do very small papule. That's why you will have less product in each papule, and it will be less painful for the patient. Also, I try, when I do the micropapular technique, I try to inject more superficially. It also helps to decrease the pain. Would you kindly advise how to treat dark circles? I usually treat, I told in the beginning that I was working in Abu Dhabi for 5 years, and it's a huge problem there, the dark circles under eyes. So I was injecting the blue Jalupro for the under eye area in a special technique. I will show you this technique because it helps to increase the density of the skin. That's why it becomes less transparent and you can see less darkness. When we talk about the injection with the bolus to the bone, I think this technique is better for the filler injection. It will help to improve the like extracellular matrix of ligaments maybe, but not of the skin. So the best technique for Jalupro would be the micropapular technique. Okay. It is suitable for pregnancy, but not injections. You need to, yes, you numb the skin before the procedures, but sometimes I don't even numb the skin when I do the bolus, like boluses. Treatments with injections and with microneedling. Yes, we will show you. Okay, I will follow the presentation. I will show you the result. First picture is before the first procedure. The second one is after fourth procedure. First picture is before the first procedure. Second is after the third procedure. And we can see the improvement of the nasolabial fold replica. So we see how the skin, on the third picture, we see that 4 months after the last intradermal injection, the skin is improving, is keeping to improve. And here the same on the other patient, we can see that the skin is continuing to improve 4 months after the last injection. That's why we can promise our patients to have the result for 4 months. Now let's come to the fun part. Let's come to the practice part. This is one of my first patients which I have injected with Jalupro. I remember that I have met Eduardo at Dubai Derma conference, and he has given me a box of the blue Jalupro, and I have injected my mom. This is the photo of my mom, and it was very popular at that moment. That it was like an Instagram trend to inject, to show how nice small papules you can make without bruises, and they are like like small beads close to each other. So right now I pretty much I don't inject in this way anymore, because it is painful, first of all, and because also it is proven that a lot of injections also help to degrade the extracellular matrix. Remember, we talked about the response to wound healing. So a lot of small injections can also activate the metalloproteinases. So this is how we started. Then we have spoken about the. I will show you my Instagram on the last slide. It is the dr.shelemba, Dr. Shelemba. And then we treating the periorbital area. To treat the periorbital area, it is recommended to increase the concentration of amino acids. We don't need too much hyaluronic acid in the periorbital area. So we take only 1 ml of hyaluronic acid out of the ampule, and we put all of it in the vial with amino acids, and we mix it, and we inject it with the microdermal papules. So total amount is 0.5 ml per periorbital zone. And the course will be same for procedures with 1 to 2 weeks interval. Now I will show you the video. Please tell me if you can you, I turned it off, now I will turn it on again, and I will put it on pause, and you tell me, can you see the video? Please text in the message. So more superficial, yes, you can see. So more superficial, the pain is less. Yes, when I inject a little bit more superficial, it is less painful, and I make very small papules. I don't make a very huge papule. I do micro papules, because when you inject a big bolus of product, it starts to sting, and it is more painful. Sahar, Fantasies, they don't see the. So what shall we do? Some people don't see the video. Can you try to follow the link again, like close and then yes, on pause, yes. Those who don't see it, try to go out of the webinar room and then join again. We will wait for you. We will wait for you for a couple of minutes. Jalupro is safe choice for patients with collagen or connective tissue disease where Botox or hyaluronic acid are contraindicated. It is a safe and smart alternative treatment in the chronic phase of these diseases. Yes, because you can even use Jalupro without hyaluronic acid. You can take only amino acids. Like in the blue Jalupro, the hyaluronic acid is like a way for me to bring amino acids into the skin. What is the difference between Jalupro and Profilo? Profilo, it has both. It has non-cross-linked and cross-linked hyaluronic acid. It's like a mix. Jalupro, it has either low molecular weight or high molecular weight hyaluronic acid, but Jalupro also has amino acids, so it has a bigger effect on the extracellular matrix. It has a greater impact on the extracellular matrix. Okay, so we open the box. We have the ampule, and we take 1 ml. I take 1 ml of hyaluronic acid, and I put this ml of hyaluronic acid into the vial with amino acids. I mix it. It mixes without any, and I take a small syringe, and I take a needle like 33 gauge, 33G needle I took, and I inject in the so we have triple concentration of Jalupro for the periorbital area, 1 ml of hyaluronic acid and all of the amino acids. And I inject, you see, I inject superficially, and I inject very, very small papules, very carefully. I don't make a big papule. And the same way I would inject, if I wanted to inject the full face, I would inject in the same way. And I would, in the periorbital area, I make a small step between each papule. They are close to each other, not 1 centimeter, even like 0.5 centimeter. You can use lidocaine. I had the topical anesthesia for this patient. You can use EMLA. In the periorbital area, 32 or 34, 33, 34 is good. If you inject too much product at once, nothing will happen. You will have just a big papule. And then I very carefully, I inject the upper eyelid. So doctors mix lidocaine inside. You can mix lidocaine in the product, but you will have the greater risk of swelling. And if it is possible, then don't mix, but you can. The injection angle is about 30%. So we can see the papules. The previous one was papules right after, and this is how they look after like 15 minutes. Okay. The doctors who could not see the video, I'm very sorry for you. Let me try to turn it on again. If you don't see it this time, you will just need to watch it in the recording, or maybe we can download it to Jalupro YouTube channel or website, so that all of the distributors can send it to their clients. Meso needle 4 millimeters, yes. Meso needle 4 millimeters, it is good. See here, I took 33 gauge needle. It is possible to use for a person with fillers, of course, no problem. I would not say that it is an alternative to the filler, because the filler, it helps to support the ligament, to put it in the from vertical to horizontal position. And the Jalupro, it helps to improve the skin quality. It helps to for each eye it is 0.5 ml. You can inject in the tear trough, yes. You use only 1 ml, yes. So you have extra 2 ml left, 2 ml of pure hyaluronic acid. So you can just inject it for skin hydration. It's not a wastage, because you just give a bigger boost, you know. The Jalupro, it allows us to, of course, you can inject it with like dilute all 3 ml with all amino acids with 3 ml and inject. But Jalupro gives us like an ability to choose. It gives us the ability, if the patient doesn't have problem under eyes, they can inject just normal concentration. If they have a problem under eyes, we can triple the amount of amino acids. It's not like it's not 100% necessary, but it's a way to give a bigger boost of amino acids to our patients. Yes, the result will be faster and better. Danger zones with this one, no, because we inject superficially. We can massage with the remainder of hyaluronic acid. We can do it with microneedling, because the micropen, it glides on the hyaluronic acid very well. So we can use the hyaluronic acid from the blue box for microneedling. The technique is superficial. Yes, like about this amount in this papule. It is, yes, like very, very superficial. The depth will be upper dermis. So this is right after, and this is after 15 minutes after injection. You see, when you make small papules, they go away very quickly. So when the, okay, how deep the microneedling? Oh, it's a very also long topic about microneedling, and also I can talk about it for a long time, because I usually don't choose a big depth for microneedling in the beginning. I usually do take a like 0.05 millimeters for microneedling, and I start working on the face just to make it a little bit pinkish, you know. It helps like to warm up kind of the face before the injection. Then I see the reaction, and then I make it all over the area, make it totally pinkish, and then I look at the reaction of the skin. If I need for the scars, for the problematic areas, I can increase the depth of the needle. How much time we have to inject? It's interesting to know Eduardo's opinion, because I know that manufacturers, they recommend to inject at the same time. It's stable, but still they don't like us to keep it, because what if we bring in some bacteria, and then we will complain. Yes. We prepare the solution when the patient with us, there is no preservative. Yes, it's better not to keep. I know some doctors keep it in the fridge. They can keep it for a few days in the fridge, but then it's up to them. It's their responsibility. If they bring in any infection, it is up to them. Okay, let's come back to the PowerPoint. And let's come to other protocols. The next one will be contraindication for Jalupro. It is like general contraindications. For example, the skin infection in the area of injection. It is pregnancy, it is breastfeeding, it is the diseases in acute stage. Like contraindication is the same as would be for any type of injection. So, and we see the good improvement of the skin density in the periorbital area. I showed you the video, and this is the answer also for people who asked about the Jalupro and hyaluronic acid filler. This is the result of Elena Rumyantseva. She did hyaluronic acid filler in the tear trough. It helped to decrease the tear trough, and it helped to hold the orbicularis retaining ligament. And she did also Jalupro, and we can see the improvement of the periorbital wrinkles very clearly. The result will remain at least 4 months after the procedure, proven by studies. In many patients, it is longer. Hypersensitivity reaction. No, we don't have the hypersensitivity reaction to Jalupro because it has very clear components. Also, I do lip rejuvenation with Jalupro. I just inject also the same papules all over the lips. It helps to moisturize the lip. It helps to just to reduce those lines. Does Jalupro help with deep pigmentation and melasma? It doesn't have any components that directly affect the production of melanin. It doesn't have the tyrosinase inhibitors. Therefore, directly it doesn't work for the pigmentation, but because it helps to strengthen the blood vessel and to improve the skin quality and density, it can help us to improve the pigmentation, such as post-acne, for example. Periorbital picture, it is one injection of filler and 4 injection of Jalupro low molecular weight. It can be used on the forehead. We can use low molecular or high molecular Jalupro for lip rejuvenation. So in this case, I used low molecular one, but you can use also high molecular one, no problem. Next is the treatment of post-acne scars. This is the result after 3 sessions. I used the pink Jalupro and I injected it with subcision. So I inject the needle. I take the needle, like 29 gauge. I take the thicker needle. I inject it under the scar. I try to break the fibrous bundles that pull this scar down to detach them, and the scar is released. It is released, and then I do the microneedling on top of it. So I put after I injected the needle and put some Jalupro under the scar. I inject all this area, and then I put some drops, several drops of Jalupro, and I work over with the microneedling. You can do 4 sessions weekly for lips, but in this case, we see the result. This is the result after 1 session. Because the lips look more hydrated and they are improved. But to achieve the longer improvement, you need 4 sessions, of course. Scars not from acne, you can also inject under the scar. If the duration between procedures will be 1 month, in some way you will just not see the very, like, the result will not be as great as if you do the course, but it will be pretty much the same. But you will still have the good result. This is the treatment of the stretch marks. Is it safe for patient with cardiovascular disease? It depends which type of the disease. You need to specify which type of the disease. You can do the full face with microneedling, and you use the full bottle for the full face. Yes. For the treatment of stretch marks, this is the combination of 2 fractional laser resurfacing and 4 amino acids injection. We will talk about mixing with Botox, Dr. Mariam. The result with the scars, it is permanent. So we see the improvement of stretch marks, and here we have one more very interesting study with stretch marks. We can see that the left side, the one that you see as left, it was treated with 3 fractional laser resurfacing, and the right side was treated with 3 fractional laser resurfacings and 4 amino acid injections, like they were alternated. Resurfacing, then after 2 weeks amino acids, then after 2 weeks resurfacing, like this. Yes, it's better not to compare in this webinar Jalupro with other products, even though I've tried a lot of products with amino acids and a lot of products with high molecular weight hyaluronic acid. But today we are discussing Jalupro because for my practice I have chosen Jalupro. So we can see on the right side of the belly, the improvement is much more obvious than on the left side. So when you support your procedure with amino acids, you will have the greater result than just by doing procedure, because you are giving building blocks to your fibroblasts. Before and after HIFU, Jalupro. So we do the course of Jalupro. We inject Jalupro 4 to 6 times. Then we wait for 1 month, and then we can do HIFU. So we wait for the new collagen to form for at least 21 days to 1 month. And then we tighten it with HIFU. Yes, it is effective on white stretch marks you see on this photo. But it is, you see, it is connected with machine. We do microneedling and Jalupro alternately or in the same session even for stretch marks, yes. And the webinar, it is recorded. So next one, we have the, I've done the combination of Jalupro and CO2 laser on this patient. This is my patient from Abu Dhabi. And we can see the improvement of her old scar, which she had for like 20 years maybe on her cheek. So I did the full algorithm. First, I prescribed to her oral supplement for 3 months, and I started doing injections. I did 1 injection per week, and I did 3 sessions totally. So I prepared her skin, and then I did a fractional CO2 laser resurfacing. And you can see that even though it happened in the country with a lot of sun and heat, and it was in summer even, by the way, she doesn't have any post-inflammatory pigmentation after the laser, and her skin is very smooth and glowing, and her scar is decreased because her skin was prepared for the procedure. I used the blue Jalupro for this session. So when, yes, it is low molecular weight, it is a blue one. Sessions for stretch marks also from 4 to 6, and the same distance between them, 1 to 2 weeks. You can use my images with mentioning the with mentioning me. Time interval between Jalupro session and fractional session. I did the good question. I did the 3 sessions, then I waited for I think it was 3 weeks to 1 month, like 21 to 30 days approximately. And then I did the fractional laser. So we let the new collagen form, and we also give the patient the ability to also during all this time while we wait for the laser, she takes the oral supplement. This is subdermal biorestoration. It is a protocol when we mix the stabilized hyaluronic acid, like for example Restylane Skin Booster with Jalupro. I will show you later the video of Jalupro with cannula, okay? And I don't want to stop on this for a long time because not all of you work with Restylane Skin Booster. And so there is no need to really spend time on this. But I want to show you the photo right after subdermal biorestoration when I have injected one side. So first one was injected and the second no. And we can see the difference. We can see the lifting ability of the product. High molecular weight Jalupro is a good option for large pores, yes, because it improves the thickness and quality of skin, and we can combine it with microneedling or with a laser to achieve a better result. And this is before and after for subdermal biorestoration. I will show you the protocol. I will text it here, Jalupro 5.5. It is when we inject low molecular weight and high molecular weight Jalupro. It means that because, as you remember, in the low molecular weight we have 3 ml, and in high molecular weight we have 2.5 ml. So total it will be 5.5 ml. That's why this technique is called Jalupro 5.5. I will show you the video of injecting this mix of amino acids. And I was telling you about the evolution of injection techniques. So I put the video on pause, and I wait for your message that you can see it. You can see that the video is on the screen. Yes, we can combine Jalupro with botulinum toxin. Is it possible to inject Jalupro between RF fractional. Yes, it is possible. It is also one of the protocols. It is a good way to do it. Okay. So we mix the Jalupro high and low molecular weight, and I inject it in the lateral face. So I take the hyaluronic acid from the ampule, from the low molecular weight Jalupro, and I put it in the vial with amino acids. And so I've already mixed my blue Jalupro. Now I take the syringe of the pink Jalupro and put the hyaluronic acid from the syringe into the vial with amino acids. So I mix it, and these, even the lyophilized, the dry amino acids, they dilute without any residue. Now I take all of my pink Jalupro and I put it inside the vial with the blue one. And I'm going to mix the blue with the pink one. So I take out 2.5 ml. Well, even a little bit more, it will be like 2.7 ml. It will be like 2.7 ml per side. For stretch mark after treatment with Jalupro, is there a need for oral tablets? Yes, to maintain the result, because if patient has stretch marks, it means they have some type of connective tissue disorder. Excuse me. So you need to take it, to prescribe it. Their skin has get more dried after the procedure of Jalupro blue. It is okay, it is normal. You just need to recommend the skin care, because the hyaluronic acid, it can sometimes attract water even from the skin surface. So depending on their climate and depending on their skin care, they can feel that their skin surface has become more dry. So then I mark. What is oral tablet? We have already discussed it in the beginning, the Jalupro supplement. I think your distributor will send you all of the information. Excuse me. So I do the opening for the cannula, and then I distribute Jalupro with the cannula. Oh, I'm sorry, because I have a very dry air in the room. I started coughing. So I turned off the video. Thank you. So I will now try to cream name. Derma. So can you hear me now? Please write. Okay, you can hear me. Okay, so we take you see that I do the marking. You see that I inject in the lateral face with the cannula. So I do like vectors in the lateral face, and then I inject 2.7 ml. So in the upper face, I have injected like 1.7 ml, and in the lower face, like 2 ml. I think my microphone is on. Eduardo. Okay. The size of cannula is 23G. 23G cannula. Okay. Because I don't like the thin cannula, I don't like the 25G cannula because it will wiggle. I like to inject more superficially. I like to inject subdermally. And the thin cannula, it will wiggle under the skin and it will be hard to use it. Then what is this? What I have taken later? Because I need to it is safe to inject in the forehead because it is not cross-linked hyaluronic acid, so you can inject it in the forehead as well. And you can, what I have taken in the syringe later, I have taken the Jalupro that I have had left from the periorbital area treatment. So it is just clear hyaluronic acid. But you can inject also the regular pink Jalupro. Okay, so you can just take one more vial, for example, or keep some extra to inject the mid part of the face, which is not reached by the cannula. And I inject the boluses. The mix is pink and blue Jalupro. Why we inject it? Because we get the large amount, which is enough to inject with the cannula. This is not to the bone, it is like intradermal boluses. The mixture of high and low molecular weight. I will show you here. Just full vial of low molecular weight and the full vial of high molecular weight. Here you see how I mix it. First I make the low molecular weight one. Then I take the syringe and make the high molecular weight Jalupro. I think we will do something with Eduardo. Like we will download the video and we will write the protocol somewhere for you to download. Yes, now we will explain how to prepare the Alutoxin. Okay, so now you have seen. Yes, we have used the hyaluronic acid and amino acids from the blue one and the same from the red one. Actually, it depends not on the platform, because my webinar is a very good platform. It depends on your internet connection, unfortunately. If the internet connection is slow, then you will have the problems. Also, if some other of your family members are using internet, it also will be slow. Okay. And in the mid phase, I inject the bolus technique. I will show you now the presentation. So you have seen the me injecting the boluses, deep dermis boluses. When you inject Jalupropine 5.5, the danger zones, because you inject subdermally, there are basically no danger zones, because you inject very, very superficially. You are doing like a scratching of the skin with the cannula. For the lips, it is best to inject for moisturizing. But for the surface improvement, you can do the microneedling. Okay. And now we will turn, for those who have stayed tuned, we will explain the last part of our practical part, which is Alutoxin. Yes, you can mix 2 vials, or when you mix high molecular weight and the low molecular weight Jalupro, it is gives the better result because both types of hyaluronic acids, they work together. Can we inject around the eye? We can inject Jalupro around the eye, yes. Okay, so Alutoxin, it is the micropapillar technique, and it was first developed by Luca Piovano. He is a very well-known plastic surgeon from Italy, and he has written an article in Prime Journal in 2018 about the Yalu Botox combination with amino acid. So what is the point of mixing toxin with Jalupro and amino acids? First effect is the soft myorelaxation. We take the botulinum toxin, it gives us myorelaxation. Second one is skin biostimulation. So we stimulate the skin with amino acids. We give the building blocks to our fibroblasts for building the extracellular matrix. And the third one is the moisturizing of the skin with hyaluronic acid. So you have 3 benefits in one procedure. And you repeat Alutoxin session once every 2 months. Total, you do 4 sessions. Now you are asking how much toxin do we take? It depends on which toxin you work with. If you work with Botox, you can see here the volume and the amount of units. So you take full vial of amino acids. Then you take 1 ml of, you can take either 1 ml of hyaluronic acid, or you can take 3 mLs of hyaluronic acid. And you can take either 10 units of Botox, or you can take 30 units of Botox. If you take 3 ml, you take 3 times, right? So you can take 30 units. When we want to do microneedling with Jalupro, should we do mesoneedling? Usually when I combine microneedling with Jalupro, I inject first, and then on top I do microneedling. So I start with injection and then I finish with microneedling. I think it works better. Oh, Mariam. The Dysport we take 20 or 60 units, and if you work with Xeomin, you take 10 units or 30 units. And you can use this in several areas. You can use the this will be the spray wood units, not in the syringe. It will be the spray wood units, right? So we can do the Alutoxin in 3 areas of our face. We can do it in the forehead, we can do it in the periorbital area, and we can do it in the chin area. And then we have the neck and décolletage. This is the result for the neck, and these are the schemes provided by Dr. Luca Piovano for each of the areas of the face. How we inject. Katerina What do you mean by plasma? So for the we can do it for the barcode wrinkles and for the poppy chin, and this is how we grade it. We avoid the area under the lower lip, and we inject only the chin area, right? Then you see the forehead. When we inject the forehead, we avoid the area above the eyebrow because we don't want to cause the eyebrow depression. So we ask the patient to leave the eyebrow, and we mark the muscle which help to elevate the eyebrow, and we don't inject in it. You see the red here, and we inject only on the lines, along the lines. When you inject the periorbital area, Dr. Luca Piavana, he shows that he injects the lower eyelid, but I usually do only few injections in the lower eyelid, and I mostly focus on the these lines on the side and on the neck. You first of all we inject along the platysma. Sorry, platysma. Platysma, yes, you can inject in the platysma muscle. You can ask your patient to show the platysma and then inject on the platysma band. You can use Azalure, Botulax. Azalure will be the same dilution as Dysport. Okay. So for Azalure, the same. This is the slide with perioral. Solution we don't keep after we prepare it because it will lose, the toxin can lose its efficacy. Sorry, Leila, what was your answer? Maybe I did not notice it. Yes, now I'm answering. Is it possible to keep solution after you prepare it? No, it's not recommended to keep it because the toxin can lose its efficacy. Are there any products or procedures that should not cross with Jalupro? Any products? It's a good question, but I'm not remembering any. I think you can mix it with almost everything. Like you can use it. It's safe, yes. Korean toxin, I try to mix Neuronox, and it gives good result. So you can mix it with Korean toxin as well. Along the line, we inject with papules. Yes, Korean, you can dilute the same as Botox dilution, right? Okay. Now I will turn on the video and I will take like a 2-minute break. Then I will return to you and explain it, okay? Okay, so here we can see I'm marking the areas which I will inject. And with the red color, I'm marking the areas which I will not inject. So here I'm marking the periorbital wrinkles. And then I'm injecting the small, very, very small papules, like also micropapillar superficial papules. You can see here, like along the wrinkles, I'm injecting these small papules. The picture of neck marking for yellow botox we will show again. And and right under the eye, along the lower eyelid, I do just like 2 to 3 small injections. I don't inject all over the lower eyelid because I don't want to get the ectropion. It is hard to compare it with the normal Botox procedure because in the Botox procedure you inject the muscle, so you block the muscle, and here you inject in on the level of the dermis, so you don't really block the full muscle. You just very softly block the wrinkles which cannot be blocked with the normal toxin. So you can combine the regular toxin with Jalupro. You can you can do the procedure of toxin, the basic one, and then after 2 weeks you can do Alutoxin. Here is my cat came to us. We can show you we will show the yellow botox for the forehead. Thank you. And here is the neck wrinkles. So I usually try to, because this patient doesn't have the wrinkles in the middle of the neck, and also sometimes I try to avoid this area because I don't want to affect the muscles of the throat, you know. For the forehead, it will be like around 1 ml total. I will turn on the light in the room because I noticed that it got dark and you can only see my face. Just a second. Okay, now I think the picture should be better. The frequency of this procedure is every 2 months, one procedure every 2 months. And I use the post-procedure cream, which is from the brand Dermaceutic. It is called Dermaceutic K-Ceutic, which has the SPF in it. It has vitamin K, and it is just has a little bit of tone. So let's discuss from the beginning how I mix it. I take the hyaluronic acid from the ampule. I put the hyaluronic acid in the vial. Name of the cream I already wrote. I will write again. And I take this port in this case. So my dilution with my we always mix in the blue Jalupro. And yes, it is better to use the blue Jalupro because the pink one, it is a little bit thicker. So it will not be, the toxin might not be spread as well in the hyaluronic acid as it is spread in the blue one. So you don't want, here I wrote above the name of the cream, and you don't want to have an uneven distribution of toxin in the hyaluronic acid. That's why I take, because the pink one is a little bit a thicker one, I take the blue one. Okay. You used all the HA from the vial. Yes, I took 3 ml of HA and mixed it with amino acids. And now all the HA from the vial, yes, I use all the HA. And now I take 60 units of Dysport. So in each small grade of my syringe, I will have 6 units of Dysport. So I take 10 grades of the syringe to withdraw 60 units of Dysport. See, I take exactly 10 grades. I mix gently so I don't shake. I mix gently so that the toxin will be distributed evenly in the hyaluronic acid. Then I asked my patient to lift her eyebrow, and I mark the area that I will avoid. And then I mark the wrinkles, exactly where she has them, and then I will inject on those wrinkles. In the periorbital area, I also mark along the wrinkles, and this will be my lines of injection. And I will not inject very closely the lower eyelid because I don't want to have any swelling or looseness of tissue in this area. So you can see that I'm injecting very small superficial papules of Alutoxin in the periorbital wrinkles. What is better, the Alutoxin or high molecular weight for the neck wrinkles? They have the different mechanism of action. So the high molecular weight, okay, I will explain. So the high molecular weight, it will moisturize the skin, it will give the supplement so it will improve the quality of the skin. And the Alutoxin, it will help to release those areas of necklines. So they have a very different mechanism of action and they have different applications. So you need to combine better. To do, for example, several sessions of Jalupro. Here I ask her to show me the bunny lines and I inject in the bunny line. And you can see that for one eye, I have used 0.5 ml of the mix. And for the forehead, I will use 1 ml. For the neck microneedling, what depth I will... for the microneedling, what depth on the face? 0.1 I start, even 0.05, 0.1 I start with this depth. Now we will come to the beginning of the video and I will again explain the amount of this port. Now I inject the poppy chin. I don't inject the area right under the lower lip because I don't want her to have the droopy lower lip. And I inject small boluses in the areas of the injection. Actually, we don't have bacteriostatic saline in Ukraine, so I use just normal saline. The neck lines. I mark the neck lines. And I don't inject in the right in the middle of the neck. I have 1 ml for the neck, and I also use a very thin needle. Yes, it is in the millimeters. Do we inject the neck where? Yes, we inject the neck in the areas where we have the lines exactly on the lines, because the lines is the area where the platysma band is attached closer to the skin. That's why we, where the platysma is attached closer to the skin. That's why we inject on the rings on the neck, exactly on them. If we have some product left, we inject in between. Okay. And now we will come to the amount of the Dysport. So with the regular dilution, we take 60 units of Dysport. In my syringe with the orange cup, I have 6 units per. I have 6 units per grade of the syringe. So I take 10 like small grades of the syringe. Maybe you need, the Eduardo needs to answer your question because I don't have the website. I have the Instagram. Does the Alutoxin help with open pores? Yes, it helps to reduce the open pores because it helps to improve the skin quality. So it can work actually like mesobotox. It helps for rosacea patients very well, and it helps for open pores as well. So, do you have more questions? Have I answered all of your questions? Because I have shown my videos that I have. This is the result. Why do we need here? Why do we need the Jalupro? Because this port total 60 units. Total 60 units of this port. No, okay, now I will show you the last slide. Why do we need Alutoxin? Because it is hard to, and we are afraid to inject, for example, the Botox above the eyebrow, right? Because we are afraid in the lateral part of the eyebrow, we don't want to drop it, right? So we avoid injecting Botox here. So when the patient has such fine lines above the eyebrow, we can use Alutoxin. It will make the skin thicker. It will decrease these small lines. 60 units for 3 ml, for 3 ml. And that's why it helps to get the result like this. It makes the skin more glowing. It helps to reduce those fine lines. It helps to improve the thickness of the skin. And you can see that we did not affect the eyebrow. I'm very glad that you have enjoyed the presentation. I have also enjoyed talking to you. I really enjoyed your questions. I really enjoyed your participation. So yes, Eduardo will give you the certificate. Thank you so much for your support during the webinar. This is the slide for the neck marking. So we mark the lines which we will inject.
Hello.
Hi, Eduardo. Hi, and here is the Instagram you were asking about. And also you have my email, evgenia.shelemba@gmail.com. If you have any questions, you can text to direct messages or to email, or ask Eduardo, because he has all of the protocols, and I think you will provide them, right, for the
yes. No problem. Just contact us, and we'll be glad to give any tips, any recommendation for better use of products. I want to say big thank you to Dr. Evgenia, because you are always great, very scientific, very professional. You have fantastic experience about aesthetics, but also about Jalupro. So it's always very, very interesting to hear your webinars, your lectures.
Thank you. Thank you so much, because when I like the product, I like talking about it, so I can talk sometimes for several hours. Yes, thank you for your support. Even you see, as you said, when I stop, my cough goes away. Yeah, thank you.
So thank you very much to everybody. If you have any question, just contact us by email or contact your supplier. We'll be glad to show videos and techniques.
Yeah, thank you. Thank you so much. Bye bye, everyone. Thank you. Thank you.